Okay, we're going to go ahead and get started. I think we have a few people still joining us, but in the interest of time, good afternoon and welcome to today's webinar hosted by the Georgia chapter of HFMA. I'm Laurie Heavey. I'm a Georgia HFMA Education Committee volunteer, and thanks for joining us. If you weren't with us last week, I wanted to let you know that starting in June, we will move this Wednesday webinar series. We've been doing it weekly since April, and we're going to move it to bi-monthly, meaning every other week for a cadence starting in June. And if you're on the Georgia HFMA email list, you should be receiving invitations for not only the webinar series, but other virtual activities. We have a couple of virtual networking events that are occurring next week. And we have the Georgia HFMA chapter board installation tomorrow, actually. So hopefully you can join us for all of these events. If this is your first time joining us for a webinar, I encourage you to check out the website, the Georgia HFMA website, to hear recordings from our previous sessions. We've had tons of great speakers and lots of great topics, a few as you would expect related to COVID-19 and financial reporting for that, as well as other best practice sessions. And for today's session, we're pleased to have Chris Jane, he's Vice President of Customer Success for Patient Co., and Andrea Mejia, Executive Director of Patient Financial Care for Piedmont Healthcare here in Georgia. Before we get started, let me just go over a few housekeeping items. As you know, the phone lines are on mute to avoid interruptions during the broadcast. If you have questions, please submit them in the question box at any time. I'll monitor that and coordinate with Andrea and Chris for their answers at the end of the presentation. We are recording this session, and the session recording along with the presentation itself will be uploaded to the Georgia HFMA website. I'll send you a link. It will come from my email address. This link will take you to the Georgia HFMA website, and there is a tab entitled "In Case You Missed It," so I'll include the navigation to get there. Everyone on today's call is eligible to receive continuing education credits. Be on the lookout for this form. Again, that's something that I will send you in via email, and you'll be able to use this form to self-submit for your credit on the Georgia HFMA website under the Membership Info tab. Now it's my pleasure to introduce our speakers, Chris Jane and Andrea Mejia. Chris is Patient Co.'s Vice President of Customer Success. Before joining Patient Co., Chris worked at Athena Health with clients in unique payment models and emerging technologies like telemedicine. Chris has also worked in managed care consulting, where he gained experience in payer processes and claims management. Andrea is Piedmont Healthcare's Executive Director of Patient Financial Care. She has more than 25 years of revenue cycle experience, and she leads the patient access and customer service teams. So Chris and Andrea, we're ready to begin. I'll turn it over to you.
Great, thank you, Lori. Really appreciate the introduction, and to the whole crowd on the phone. We're excited to be here. I think we're going to have a great conversation today. And Andrea, thanks for letting me rope you into this. It's going to be a pleasure. And of course, all the smart things are going to come from your mouth. So thanks. And why don't we hop into it? So we'll go into just some brief introductions as we get things kicked off today. But the theme of today is really how do we engage with patients in a compassionate financial way, given the circumstances that we're in right now. So we're going to hit on kind of three main focuses as we go through things. First is, let's understand the concept of compassionate financial care. And that's where Andrea is going to share a lot about what she's done over the years at Piedmont with her wonderful team, and how that's translated to helping things out now. Then we're going to talk about how do we reduce barriers to entry, more from an operational and policy perspective. How do you make it as straightforward and simple as possible for patients to engage not only with the health system, but also from a financial perspective? And then finally, we're going to wrap up the last section of looking at digital patient engagement, and also how does that help empower staff in these times as well. So I think it'll be a great discussion. We'll have an opportunity to poll the audience midway through the conversation. And obviously, as Lori said, please chime in with questions. We'd love to carve out time at the end to chat through that. I'll give a brief primer on Patient Co. Patient Co was founded over 10 years ago, really out of a desire to simplify the way that patients interact financially with their healthcare providers. What started as a mission to make statements easier to read and to pay, for that matter, has grown into a full suite of products and services that reduce complication throughout the patient financial experience. Recognizing that effective outcomes can't be achieved without simplifying processes for both patients and health systems, we really root our development and service process in ensuring that the user experience is optimized across the board. This has allowed us to partner and thrive with various different health systems across the country, large and small. We're currently providing services in over 3,000 healthcare locations, and over 16 million patients have benefited from our product. Through this strong network, we process over $1 billion annually. And of course, in particular with this audience, we're extraordinarily proud to be an HFMA peer-reviewed organization. I'm now going to turn it over to Andrea to give an overview for Piedmont.
Good afternoon, everybody. I'm glad to be with you today. I have had the pleasure of working for Piedmont Healthcare now for almost 8 years and been able to see our organization just grow and expand in the Georgia market. Piedmont has a foundation dating back to 1905, and predominantly we have been in the Atlanta market. But over the past several years, we've been able to expand into other markets and regions of Georgia. We now have hospitals near Athens, or in the Athens area, and then down in the Columbus market, which has now taken us to over 11 hospitals to serve Georgia. In addition to that, we also have expanded care into urgent care locations, quick care. You may have seen us in Walgreens. And then we also have a growing population of physician practices across the state of Georgia. Along with that, we have grown as an employer base and now represent over 22,000 employees in the state of Georgia. So our focus as an organization is very simple. We really are purposeful about being intentional about making a positive difference in every life we touch. And so I hope today that you'll be able to see that example when we talk about the things related to the patient's financial experience.
Great, thanks, Andrea. So let's kick off now and talk about this concept of compassionate financial care. Not only has Piedmont been a great partner with Patient Co for a while, we thought as we were getting into this discussion, Piedmont was uniquely positioned to be able to speak to this concept, especially now. As an Atlanta-based health system, Piedmont was among the earliest Georgia hospitals to need to adapt on a large scale to COVID-19. So we're going to cover some of the approaches that Piedmont has taken pre and mid-COVID response. Not quite at the post-COVID phase yet, obviously. What are the things that they've done to maximize patient financial engagement in this compassionate, balanced manner? And so I'm going to turn it over to Andrea, but before I do, I think the theme that we want to continue to reiterate throughout this is you're going to hear us talking about things like balancing quite a bit. How do you balance financial care? How do you balance technological engagement? And we'll do our best to avoid the cliches that we're hearing, like now more than ever and new normal and all of those things, but give us grace if we slip, because it's inevitable. All right, Andrea, I'm going to turn it over to you, and maybe you can lead off with talking us through the definition of patient financial care and perhaps some of the history behind it.
Yeah, thanks, Chris. As Chris mentioned, we at Piedmont have been looking at how do you better support patients through the financial experience in connection with their care. I know many of you on the call have probably done research or read articles and reviews about the connection between the patient's financial experience and their clinical experience. And so a few years ago, we began to take an in-depth look at that at Piedmont and really identified a simple concept that we realized if we could equip patients with information and provide them payment options, that would help them to have a better financial experience from their healthcare needs. And so we started driving multi-year initiatives in partnership with not only the revenue cycle team and our technical partners, but also within the patient experience team in our organization. And from that, we were able to develop several strategies and implementations that we've been able to do through the years. And so on the next slide, you'll see some of the elements of things that we focused in on related to that. And so we first stepped back and took a look at, well, what are patients really wanting? They're wanting to easily understand financial communication. So whether that was estimation letters or their statements or whatever information we may be providing to the patient, they wanted to be able to comprehend it easily. We also realized that there was a growing need to not stay with our existing channels of communication, but actually meet the patient where they wanted to be met. And so whether that was via phone or actually turning to more new technologies such as emailing or text messaging, we needed to start changing our environment to be able to support that. Additionally, we wanted to be able to equip our patients to self-serve. I'm sure many of you healthcare organizations out there that may be listening to this were like we were, where in order for a patient to get a payment plan, they had to speak to a representative with Piedmont. And we wanted to be able to move to an environment where we could actually empower the patient to self-serve with that. So we started engaging, well, how do we understand those options? And then additionally, making sure that a patient could navigate the historical financial experience with the patients. We had a platform before that wasn't quite meeting our needs, and so we wanted to understand how do we actually provide that detail to the patient in a better format. And so along with that, one of the considerations that we needed to have is, that technology, whatever technology we would embrace in our system, that it would need to integrate with our current systems that we have. We are in an Epic environment, and so we wanted to make sure that it would integrate with that with any changes. And as I mentioned earlier, digital alternatives are something that we wanted to focus in on too. So we have an ability, for patients to receive e-statements and start looking at that available to the patients. And then just other clear payment options in the communications related to that, and that they could be tailored to a patient so that they could meet what their specific needs are, and we weren't just solely driving that ourselves. And so just trying to think through, what the patient's needs were, how we could transform our environment, led us to making some significant changes the way we support our patients.
Thanks, Andrea. What you've laid out here is something that we've been hearing a lot. Needless to say, this is something that we've been passionate about since inception. I think what we've noticed in the market, particularly over the past 3 or 4 years, is at one point, a lot of this was considered the nice to have, and now it's really shifting to a need to have. And so as we look into what things are looking like in the COVID world right now, does that change that? Do we accelerate the need to go through a lot of these things right now? So I'm reticent to put stats up on the page because everything that we're looking at is changing by the minute. But needless to say, COVID-19 has emphasized the importance of compassionate financial care and engaging patients digitally. And we'll get into that in much more detail later. But as we look at some of the statistics that we've gathered, 68% of patients are concerned about their ability to pay for medical expenses this year. And then similarly on the technology side, we're seeing an 80% expected year-over-year growth for telehealth due to the pandemic. And I expect that both of these numbers are going to increase over the coming weeks and months. One thing that I want to anchor on is how are you meeting patients where they are? How do you look at that both literally and figuratively? There's the physical of how do you actually meet a patient where they need to be, and then financially, which is what we'll focus on quite a bit today, how do you make sure that you're meeting their needs from where they are? Andrea, if you wouldn't mind kind of anecdotally giving us just a little preview of what are some of the key things that you're seeing engagement increasing on over the past few weeks? I know we're hearing about telehealth across the board, but what are some of the other tools that you're seeing patients really adopt rapidly?
Yes, telehealth is just taking off like gangbusters for Piedmont. It really became that alternative environment to service our patients and meet what they had and a need to continue their healthcare experience. But, we had to quickly adopt to it. And so that became a forefront for us to focus on. But in addition to that, we already had in motion online scheduling. So we had patients beginning to engage in that. So really what's taken us by surprise is how quickly people have adopted to some MyChart integration that we did not have available previously. We made a decision in March to turn that on, and organically overnight, it just seemed to have been adopted by our patients. And so we've seen a tremendous uptick in that. And so that just provided some digital engagement with our patients that historically we had struggled about how do we actually handle that and promote it. And patients are seeking it now. And so we're positioned now to be able to engage that more. And so it's going to transform that experience with the patient and drive, I think, a change in our operations much quicker than we had anticipated. So I think that's a positive that's coming out of this, is that we're going to gain some transformation and really efficiency from a patient experience and even internally operationally.
That's great. Well, let's jump into some of those specifics now, and I think we're going to have the chance to come back and visit that a little bit later too. So, for this section, we're going to talk about how, really operationally, a health system can reduce barriers to entry for patients. We've all shifted the way that we work in many ways over the past couple of months. So we're going to focus on, what are those operational and policy changes that can help keep things afloat. So Andrea, I'm going to turn it over to you for the next couple of slides and have you walk through some of the key things that Piedmont did and really how you prioritize the changes needed.
Thanks, Chris. Overnight, it felt like we had this change in our environments, right? Immediately, for those in the healthcare business and the hospital specifically, we felt a change in our outpatient volumes. And so that had a direct impact to our cash flow. And so how do we, start thinking through accommodating for that and getting back to a normal day? Along with that, as I mentioned just a moment ago, it's really the increase in telehealth. We had not only was our physician organization, physician practices trying to implement that, but then we went into the hospital side and started to look at, how do we do this in wound care? How do we do this in physical therapy and nutritional education and other areas? And we don't have all the answers yet of how that will play out, but that is something that's now bringing up this demand that we didn't have, 60, 90 days ago. And so how do we accommodate for that? And now that we are here, at least in the state of Georgia, starting to reopen, how do we now be proactive about resuming our operations? How do we model this out and understand how do you bring back volume that had just stopped in your radiology and imaging areas? And being proactive about how do we coordinate within the organization related to that. So as it was introduced in my introduction, I work with patient access or registration. So how do you start accommodating for all of that and adjust for that? And so to help us at Piedmont eliminate some of the barriers to really restarting our business, we did make a decision to pause on payment requirements that we had in place. And so we had a pretty robust payment requirement process at Piedmont. Been working on it for several years and healthy upfront collection activity. But we realized with so many things that were in play for a patient to get back into their healthcare needs and experience, we wanted to eliminate some. And so we did make a decision to pause on it for the next 90 days. And also to assist us with that, we decided to also implement a requirement for 100% of our scheduled visits to go through a pre-registration. That was predominantly to help make sure that we were doing the appropriate COVID screening that our organization wanted to make sure was in place before patients came in for their care. But it also allowed us then to just streamline that registration process when they came in. Now, I want to mention that we are still informing patients about their liabilities, and we're still asking for payment to be made. But the difference is now that any requirements that we had in place is what we've put a pause on temporarily. And then I think also one of the key things to help us get back started is to be proactive. We've been reaching out to our patients. So just going back through our cancellations, and we've got a whole team that is focused on reaching out to the patients and getting them back in for services at Piedmont. So, those are things that really have been, they're simple things, but they're things that we wanted to make sure are in place. And what's interesting about the pre-registration is we, had always really had that optional door in play for pre-registration. And now it's really focused in on how do we actually make this now a requirement and really get the patients prepared before they come in for services.
That's great. Andrea, as you're hearing anecdotes from your team as they're reaching out to patients to reschedule these services, what are you hearing from the patients? Is there still a large amount of hesitancy for these services that presumably are very much needed? And, how does that inform some of the additional changes that you're planning on making?
Yeah, that's a good question. I think the hesitancy is from a couple of different angles. as we all know, there's been many people that have found themselves unemployed during this time. And so there becomes that financial barrier. Maybe they became uninsured during this time. And so those are considerations I think that our patients are making before they continue services. And then I think also people just need to understand that they'll be safe when they come into our organization for their service. And so there's several steps and protocols we've put in place to ensure that for our patients, whether it be when they arrive at our hospitals, that we have a methodology that they don't enter into our hospitals until they call us, and then we tell them when to come in. We are doing pre-admit testing for the COVID screening in our parking lot, kind of a drive-through model. So just trying to be creative ways to eliminate some of the risks that patients may be feeling. And I think with this too, we have to recognize that many of our hospitals are also putting requirements for the visitors in place that you can't have them, and so under unique circumstances. And so I think it's just an unusual time that we're all trying to be safe and try to follow protocols and mitigate the risk. But these are things that a patient didn't have to think about previously, and they are having to consider that now.
Yeah. Well, I think this provides the next segue into this next slide. As we take a look, in a pre-COVID world, this is largely a representation of patient code data. And I think as I talk through this, those of you in the revenue cycle world will largely agree. What we're seeing here is a trend of balanced payments. And so this dark green bar at the top represents patients that are largely willing to pay their bill in full, that proportion of patients, or some level of payment, excuse me. This dark blue is patients who are paying in full, and then we see partial payments creep up. As balances exceed $500, this is where the lines cross. This is something that if you sat in on a patient code presentation before, you've seen likely some version of this. And that's not surprising. The more expensive things get, the more options that a patient needs. When we're looking at this tremendous amount of Georgians that have filed for unemployment since mid-March, we're anticipating and already seeing across the base, not just in Georgia, this need for partial payments that will likely exceed or cross over that curve even sooner than before, to Andrea's point, as more and more patients are going uninsured and facing financial hardship. Now, that is a challenge, and it's something that all of us on this call have projected for to some degree. But what's important not to lose sight of, however, is that this indicates patients are still wanting to engage in the payment process. As we hear from our clients, as we hear from patients that come through, there are requests to have more flexibility in plans. And so when we look at opportunities here, and Andrea, I'd love your take on this in a moment, from a policy perspective, these are the things that we're seeing thematically come up quite a bit. Revisiting payment plan rules for greater flexibility, not just on the rates, not just on how much you can pay in a given month, but on the timing. When can you start it, or when can you pair a payment plan to when a paycheck may be coming in, for example. Leveraging things like third-party financing if the payment plans aren't enough. Health systems may, in a prior state, have been more willing and able to self-fund their own payment plans. As we shift to this, where cash is more difficult to have on hand, this is where a third-party financing option could be an appropriate option. And then finally, utilizing things like maybe a card-on-file payment model, which allows patients to have more security and avoiding that need to pay upfront, but having a sense that they're having a patient-friendly hotel-like experience, so that you balance the health system making sure that they can secure some level of payment, and patients feeling like they've got some level of security and not paying for an unknown at this point. And so, Andrea, I'm curious if you would like to chime in on any of these opportunities, and as you know, the next slide, we've got a few more things that we can chat through as well.
Yes, actually, for those opportunities, that is where Piedmont's been. We immediately went to go look at our payment plan rules and created flexibility. We offered a 30 or 60-day delay on when those payment plans would start. And so we, revisited what we had put in place. We had actually narrowed down our in-house payment plans because we've implemented a third-party financing option. But we decided, given the circumstances that are going on, to go ahead and start to modify that. And so we did put that in place, not only as you speak to one of our customer solution center agents, but even our online self-servicing model, we modified that. Additionally, as I mentioned, we already had a third-party financing option in our environment. But given what's going on now, it's pushed us further to look at how do we leverage this at time of service. And so really revisiting that timeline and when we were going to explore that to be more current. And so we are in an active project right now to be able to provide that and see that as part of our recovery plan. As I mentioned earlier, we put a pause on payment requirements, but part of that is we wanted to make sure we had robust options in place more than ever for our patients to be able to finance their healthcare expenses. And then the last item there, we're also in exploration of that. We think that's an option that many of our patients would be interested in, to be able to put that card on file. So I'm looking forward to these changes in a very quick way to impact our patients at Piedmont.
That's great. Well, let's flip to the next slide too, because I think that really the conversation continues. How else can you tailor financial options through this process? And Andrea, as we had the chance to prepare for this, I think the items here really called out how you can continue to add on to existing functions and policies that you have, and they also bring up some interesting questions given the rate at which things are rapidly changing right now. So again, not only allowing, as mentioned on the previous slide, patients to be able to have flexibility in their payment plans, but what if they have multiple balances outstanding? How can you help them consolidate that and make it easier so you're taking away that extra burden of them juggling 4 or 5 different payment arrangements that they have going on? How do you consolidate that and potentially make things a little bit easier for the patients to pay? Similarly, and Andrea, I'd like your take on this. When we think about the concept of propensity to pay, there's numerous different scoring methodologies out there, all of which have their own different flavors that give you a sense of what's going on. But how can you use that, especially now, given how quickly jobs are changing for patients, credit profiles, things to that effect? How can you use something like that to not only think about propensity to pay, but propensity to engage, right? How do you make sure that you're just getting the patients to understand and engage somehow in the payment process? And then finally, how are you able to update language quickly and dynamically so that patients can be aware of what's going on? And last, what conversations can and should be had with your agency partners that you're working with? So I've basically read through the bullets, but Andrea, would love to get your take on these.
Yeah, I think, the propensity to pay scoring is, it's an interesting stat to use. And as a client to so many organizations that actually provide the type of scoring, you always have to decide, well, which one are you going to go with? And so I think, right now at this point in time, what a patient's propensity to pay, if it's reflective of historical data, if they lost their job a month ago, it's not going to reflect that, right? And so I think you obviously have to pay attention to that. But as the months go on, I think that's where we need to look forward to. So I think there's a now consideration that we all have. Really, it's about getting people back into healthcare and eliminating the barriers. But on the other side of the recovery of all this, we obviously then are going to still have to manage what the patient's financial responsibility is. So we are going to need that insight and that data. And, what a patient may have an ability to do in the month of June may be different by August or September, depending on how quickly they found a new job or go back to their previous employer or what's going on in their personal finances. And so I think we're going to have to balance how we use that data to drive our decisions relative to that. But at the same time, I think we should be looking forward to, well, where were we not using that data that maybe we should in the future? So if, within your organization, if you're not using it on the front end to help navigate some financial options for the patient, maybe that's something you go to start to explore. How do you understand that as the patient enters into the organization? Many of us just focus on that post-service, and it makes decisions on how we send accounts to an early out agency, or maybe it's changes statement language or whatever it may be. And so I think we just really need to challenge ourselves of, how can we, not only now, but maybe in the future, continue scoring like that to help us make decisions. One of the immediate things, obviously, that we did is we're in the process right now of changing our language, whether that was in our My Chart we have e-check-in in place. Changing language there. We're going to change language in our consent form, our statements. Just to put that messaging out there like we're seeing in so many of the other industries, understanding that people are in this circumstance of this pandemic and may have a financial need. We're here to help you. Just making sure that they understand that they can engage with us and we can assist them. And then lastly, just have those conversations with early out agencies, your collection agencies, to make sure that you're getting an understanding of what they're hearing, because they're, operating on your behalf also, and, they may be getting pressure from your patients to make different changes. So just making sure you're having that engagement with them and knowing what you need to do to help them to be effective for you too.
That's great. Well, let's move on now into digital patient engagement. In the current landscape, how should a health system consider adapting their digital engagement strategy? So over the next few slides, we're going to focus the discussion on how patient preferences may be shifting right now, or maybe not, and how to make the most of it from an engagement perspective. So first, I want to share, the fact that these are things that we and many of us in the industry have been measuring for a while, and I don't think there's a tremendous surprise. So obviously, telehealth is something we're hearing a lot about, but going beyond that, we see that the patients prefer digital enrollment. The data we see here is from patient and provider survey that we had last year. We're getting early results from the one this year, and the themes are the same, right? Patients prefer to have online enrollment as much as possible, not surprisingly. But again, we'll probe on that in a little bit more. So how do you take something like that and drive that to areas beyond clinical engagement or even just registration? So themes that we've already hit on before: self-service enrollment and payment plans. And this was something that Piedmont made the decision to push forward several years ago, as Andrea alluded to in the intro. Shifting that correspondence from mail to digital channels doesn't mean that you throw everything out, but allowing the option to be able to have digital channels. And then as we think about that, particularly now, how do you move that beyond the more traditional communications like statements, like registration forms? What about things like charity care applications and other financial assistance? And again, finding new ways to leverage patient portals. There's a ton of functionality out there, but how do you make sure that you're getting the most out of them and navigating patients appropriately across the digital spectrum? And so when you think about the benefits, the why for these things, it allows for scalability not only for your team, but most importantly, it's a great patient experience, because this is a world where we're doing everything from our phones. I don't need to tell anybody on this audience, I'm sure, but it also drives that future digital engagement. It's by you're planting that seed so that as new tools come out, as new innovations come out, you've got patients that are already used to associating you and your health system with digital adoption and engagement. So it's going to make the next thing even easier to adopt. Andrea, be curious if you could just give us a little bit of the background on telehealth to start with, because I think you had some interesting perspectives on how that came out. And you've already hit on My Chart, but if there's anything else you'd like to add, we'd love to hear it.
Well, as I mentioned earlier, telehealth was like overnight we had to do it. We had to have an alternative platform. So you still had the need, though, to, check patients in, right? Like you had to have an account, you had a way to bill them. And so with that, we tied the experience to our My Chart e-check-in. And so not only did that allow us then to basically cover all the demographic and financial information, but it allowed things such as patients to scan and upload their insurance cards. It allowed them to digitally, rather electronically, sign their consent forms, which is a big deal for patients, particularly now. And so I think that just that promotion of that self-serving that has come up out of the telehealth visits has been phenomenal. I think I mentioned earlier too, we decided to turn on e-check-in for all of our services. So whether it's going to be just a telehealth or if it's going to be a walk-in based service, you now can check in through MyChart with that. And I think just that empowering for the patients is been exponential. It's rather surprised us how quickly it's adopted. And I think even from the employee perspective, from our own internal perspective, you know, it's one less form for a registration staff member, for example, to have to manage if the consent forms were signed electronically through MyChart and through that e-engagement. But the other thing I would mention too is just even post-service when they're trying to manage their financial responsibility, our teams have seen engagement grow through the years, whether that was from, you know, originally it was just email options, and then we moved into secure messaging. We use Patient Wallet, secure messaging, and then we also have chat features that are available on PMOT.org. So we've been trying to create multiple ways for our patients to actually engage with us outside of telephone experience. And so we've seen that growth in our call center need to support that type of digital communication. And I would anticipate that would continue to grow. I think that patients are going to become more willing to do that type of experience. And frankly, it's present in a lot of their other aspects of their life. And so to have that now in the healthcare environment really is empowering for them to be able to do that.
That's great. Let's take a moment now. I think we've got a poll set up. So Lori, if you can help us manage on the Zoom side of things, you know, just to get a sense of those who are listening in, which of these tools are not offered by your organization today, to get a sense of where things are going. Okay, I'll give it a minute. This is exciting. So, Andrea, as I'm looking at these results coming in, it's intriguing to me, and in a lot of ways not surprising. But this brings up one of the questions, one of the items that we discussed as we were preparing, where you know, different organizations have different abilities, different technological you know, budgets at the very least to be able to offer a lot of these things as we look at self-scheduling and other features. And so, you know, as you know, to the audience, as we're talking through the rest of this, and as we get into the Q&A in a little bit, I think it'd be interesting, Andrea in particular, to get your perspective on what are some other things that can be done short of technology, or you know, where would you highly recommend balancing that? So let me see. Can everybody see the results that we've got?
See the results, yes.
Okay, great. So as we look at everything, I think not surprisingly, we see most organizations are offering some kind of online bill pay. Text to pay is not commonly widespread, and we can touch on that in just a moment. Patient-initiated payment plans, or put another way, a self-service payment plan, it's fairly common. And then we start seeing self-scheduling. About a third of organizations are not offering that today, and then a handful are already doing this full suite of items across the board. You know, Andrea, does any of this surprise you, or as you look at these options out here, you know, what are the things that you're grateful to have, I guess, and what other commentary do you have?
No, it doesn't surprise me because, again, I think that in other aspects of our patients' lives, they have the ability to handle their business digitally. And so healthcare has just been lagging in it for a while now. And so to start to see these things come to play and really become viable options. And I think, again, given our environment right now, that empowering experience and ownership that a patient can get by leveraging some of these offerings will really help to the adoption. You know, I think in the past, I've been doing this a while, and many people used to be worried about, would the older generation do these, you know, as we move to kiosk check-ins or, you know, more online experiences. And we're actually finding that they are. I know in my own household, I have seniors and my parents, and they look forward to it. You know, they're using these digital experiences, and anything to kind of alleviate those burdens for them, you know, they're going to engage in it. So I think we've all got to look within our organizations and figure out how do we embrace these further, because they're not going to return, they're not going to go away. I think that these administrative type elements that we're talking about today really need to be streamlined, and the digital platform is the way to get there.
I completely agree with you there. Let's wrap up this section. And in the interest of time, we don't have to hover long here. And I'll be honest, as we were preparing for this talk, I considered cutting this slide. You know, in many ways, it feels a little redundant after the last couple of slides. But one thing I do want to bring up that is a good question. You know, we look at the breakdown of digital channels that are preferred for patients: chat, email, text, secure messaging, and the benefits are obvious here. One thing that we were discussing was, is this shifting right now? These are tools of convenience, but particularly now when we actually can't have a face-to-face conversation with somebody, is there any shift? And Andrea, it sounds like Piedmont's done some interesting things to help bridge that to a degree, but if you could spend just a minute sharing your perspective on that, it'd be great to hear.
Sure. Well, one of the things that we did as an organization just to help the patients from bring in clarification into COVID questions they may have had is our call center team, our patient connection center, stood up a nurse hotline for the organization. And so immediately we had inbound calls from patients just asking questions, needing clarification. And so we found that personal touch and availability was really valuable to our patient population. At the same time, in another setting, and we were faced with, well, how do we handle covering our financial needs and our registration needs in our emergency departments and protect our staff members at the same time when we were all facing issues with personal protective equipment being available. You know, there was a surge there at the beginning for every healthcare organization to look at, you know, what were the quantities of equipment you have and make sure you were preparing and protecting your patient and your clinical partners. Well, what do you do within your administrative partners, such as registration? So we ended up adopting and moving to remote registration for ED, for the emergency department registrations, which is something we'd never done before. We were at bedside environment. So we went to the bedside and manually registered the patient. And so we made a decision to navigate that by centralizing the staff members and begin doing that by phone to the patient. So whether that was calling the patient by phone in the room or by calling their cell phone number that they had provided to us at the beginning, we started leveraging that. And in some of our hospitals, we ended up actually removing some of the registration staff out of the emergency room and put them in the conference room and, you know, did social distancing and started handling that. We'd never explored anything like that before. And ED registration is always a difficult dynamic to staff for. High turnover, you have to balance the volume hours, it's 24/7. And this became a mechanism for us that we still have in play today. Now, it did not solve for every registration type that we had to do. There's still those that we needed to go to bedside, possibly together or partner with a clinical partner to get the information. But that was something that drove us to a different experience. And so that was interesting for our patients to start navigating and interacting with this. And we'd like to enhance what we've put in place. And I'm not sure how long we'll keep it intact, but I think it's definitely going to drive us to thinking different related to that. But I think one of the things that I've just learned through this is that the patients really still prefer that human touch when it comes to the clinical experience, but they are willing to become a little alternative the way that they've historically handled more of their financial related experience.
That's great. Well put. Well, let's wrap up real quick talking about how do we empower and engage your teams? How do we make sure that they're empowered to do their jobs, they're safe, and that those of you in management can still effectively manage them? I promise we won't turn the last 15 minutes of this into a full diatribe on how to set remote work policies, but there's a few things that we do want to call out. And so, Andrea, again, I'll run through this real quick and would love any additional points that you could add here. But we from our end, we kind of framed it in two ways, right? Operational and security considerations. So on the operational side, I think you kind of hit on this. Which functions are required to work in the office or in the hospital, and which can operate remotely? And then, for those functions that can't work remotely, what needs to change? So I love your example of shifting ED registration to being remote. That was probably not something that would have been considered before this. So again, would love to get your feedback there. And then on the security side, are the proper security policies and procedures in place and communicated to the teams? And recognizing that policies, especially in large organizations, don't change quickly or easily, what are some of the things that are worth considering right now? And then finally, with us as a payment company, what are the implications for PCI scope and compliance? With a whole staff moving remotely, do they have the security tools in place to make sure that you're processing payments, keeping your business going in an appropriate way without putting you at security risk? And again, that's one area. Just to do a brief plug, this text-to-pay concept is something that we've seen tremendous adoption for among our clients, particularly now, because it's allowing patients to pay and it takes PCI burden off of clients. So I'll flip it over to you, Andrea, and get your take, and then from there we can move to wrapping up pretty quickly and shifting to questions for the last 10 minutes.
Sure, I'll just mention what our experience was at Piedmont. We'd had remote working for a few years in play for some key roles, for example, like coders, that had a long runway of working remotely. And then we had a handful of staff members that did work queue management, kind of remote work, that they were able to do that. Or maybe it was more of a blend. They did part of the week in the office, part of the week at home. Literally, it felt like overnight we were able to navigate. We pushed, from what was normally an office full of 1,000 people, we put them remote. And so we have resulted in just a handful of people actually coming into the office. And in some of those cases, the only reason they're coming in the office is there's certain work that obviously we still had to do manually, whether that was communications out to the payers or the patients. We had to have somebody actually come physically in to go touch and push that work out. And then we did have a few employees that did not necessarily have the best home environment, and they were not ready or equipped to be able to work remote in their home. And so, we wanted to respect that. And so through some due diligence, we did make some arrangements for that. And so that is the way we're still working throughout Piedmont, and we'll continue to be doing that for a while. And honestly, we're going to take that good look at, well, what does the future look like? How do we embrace this? How do we start bringing balance into that? And I'm sure we're like, other healthcare organizations are looking at us. What does your new office space look like? And how do you accommodate for bringing people back into the office when the time is right? So we're in the influx on that decision, but it definitely pushed us to doing things such as bringing staff members into webinars and communicating differently with them. But I can speak to, on behalf of Piedmont, I've heard some fabulous stories about people still feeling connected to the work they do and the purpose of what they bring to Piedmont every day. And so that's reassuring. It means we're doing a good job at the engagement. But it is different. It is different when you do not see each other every day. And so I just think that communication and still being personable is important in that experience.
That's great. Thank you. So we'll kind of tie it together as far as, there we go. There's the new normal. I knew I tried to scrub it, but we've got it in here somewhere. So when we look at summarizing a lot of the things that Piedmont is doing, offering e-check-in for all locations, making those operational changes to ER registration, capturing consent electronically and verbally. Andrea, I don't think we actually hit on that one, but it'd be great to hear your points on that. Using not only patient-facing chat, but internal team chat, and bringing the frontline teams into this world of WebEx to make them feel connected. I think what what I bridge together as I see this is a lot of these are the same strategies that you're doing for patient engagement that are working well for your staff. And it's a virtuous cycle where the more that patients are able to self-serve, it helps free up the staff in certain ways so that we can all adapt better to this. And as we push into conclusion there, any final thoughts that you'd like to add, Andrea?
Well, there is definitely a new normal for us. I think that I certainly thought that we would be moving to a more digitally engaged environment when it came to things relative to revenue cycle. I did not anticipate it would be now. But so we are quickly just looking at what we can do to be able to bring that to fruition for our organization. And, we'll see what a year is from now. We'll see what the next season is of flu or whatever. These things I think we're putting in place just will mean that our healthcare organizations can really focus on what they need to, which is really taking care of all of our patients.
That's great. All right, I'm going to move to just kind of the last slide, just recapping here. When we look at these themes, right? Digital engagement, adding convenience for the patients, personalized engagement. How do you tailor that outreach to address the unique financial needs of patients? And affordability. How do you make sure that you're offering flexible payment options, be that payment arrangements or financing or whatever? These are not new themes. And I think to the point you just made, Andrea, about you didn't expect this to happen so quickly, I think that's what this has put in stark reality. It doesn't actually change what you need to do. It's probably just prioritizing it even more. And so, as we look through that, I think this is a great way to cap it off and really wrap up the conversation and leave the next few minutes for Q&A. So at that point, I'll flip it over. It looks like there's a little bit of activity going on through the Zoom chat and otherwise, but
Right.
Lori, are you keeping track of this?
I am, yeah. So,
great.
So let's go back. I'll go through some of the chat questions, and Andrea, I believe that these first two are probably directed to you. How are you addressing the uninsured in the telehealth environment?
Yeah, that's a great question. Right now we are taking a conservative stance on the telehealth because the majority of it was really to try to help the patients from a COVID perspective and be able to get support on relative to that. And so, we're all hoping that we get some reimbursement, from the federal government relative to those visits. So we did not put a lot of expectation for patients to have to do prepayments or pay up front relative to that population. Obviously, that puts a burden on us on the back end to be able to reconcile to that. But we're going slowly into payment requirements or payment collection even in the telehealth space. We do think we'll get to a new norm on that, but part of it is understanding what payers are going to cover and what they're not going to cover. And so understanding how they're going to reimburse those is something that we're still exploring and trying to make sense of.
Okay. So this is related, another question. Are you looking at paying COBRA for some of the recently unemployed?
That's a good question. We've had a practice into considering that previously for our patients, and it really has that financial validation process still in place. I'm sure we've considered it. I can't speak to how often, but I think that, it's a balance when you do accommodate that for the patients and working with that. I think part of it is just working with patients to make sure they understand they have that as an option also, right? They may still having a financial ability to pay part of the COBRA to be able to cover some of their healthcare needs, because it's not only just with the hospital, right? It may be follow-up care that they need. And so balancing with that.
Right. The next question here, I think actually you answered it as this person was typing the question. It had to do with propensity to pay data and how accurate it is now or valid it is now, where we have people who are unfortunately being furloughed or losing their job on a daily basis. I think you already made the comment about you just have to use take that data into perspective and understand what you're looking at over the next few months. But I don't know if you have any other comments you want to share about how to balance the P2P data.
I mean, none of us have ever experienced this before, right, in our lifetimes. we've never had anything mass like this happen to us. So I think that's why you have to be soft in that utilization of that information to drive all your decisions right now. But again, I think I would recommend looking at gaps where maybe that information has not previously been leveraged, and how would that make sense to include that in an operational workflow in the future, such as the front end.
Okay. And then Chris, this is probably a question for you, although I know Mallory has shared some of the data from the patient survey you referenced earlier, but the question is, do you have an age breakdown on the digital preference of 69.2%? So I'm guessing how many of those are, millennial, Gen X, that kind of thing.
I don't have the exact numbers in front of me, but what I can tell you anecdotally is that it's a much more even distribution across age ranges into the older age populations than anyone would expect. When we look at the fact that 80 or 90+% of people in the United States have smartphones, when we look at the age of users that use our platform, it's often those well into the 80s and 90s. So I think it looks like Mallory shared the link. It may have a more detailed breakdown, but we're happy to follow up with something like that.
Right. Okay. And then Andrea, this is a question for you. What platform or vendor Piedmont is using for the chat functionality of your call center, and what integration with Epic, if any, is available with that chat function?
That's a good question. Well, we have secure chatting or messaging through the patient wallet. That's one of the avenues that we have. We also have secure messaging through our MyChart experience because we are an Epic environment. We have that. We have it on Piedmont.org, and that is through a company called Loyal. And then we've got good old traditional emails going on out there.
Okay. Okay, great. All right, just a quick reminder, we have a time probably for another question. All right, here we go. Since most people prefer to pay their bills online, are there statistics that show better success at online collection versus in-person paying or paying by phone? So Chris, maybe you want to take a first whack at that one.
Yeah, the short answer is yes. The online engagement that we see is more successful in a couple reasons. One, it's more digestible. So we see patients that they may take a little bit more time. They'll click through and look at options a couple different ways, and that's a lot of what our product team looks at, is how they're navigating. But what that leads to is patients feeling more secure and understanding their bill and understanding the payment option they have. The other piece with that is it makes it easier for that repeat follow-up, whether they've signed up for a payment plan and they're checking the status of that, or if they have a new bill coming in. We see that the online engagement continues to have much better collection rates across the board.
Okay, great. Okay, I think that concludes the questions that we have here. So just a reminder, everyone, that our special Wednesday webinar series runs now through the end of May. Please be sure to join us at 1 p.m. Eastern each Wednesday. We'll be back here, same bat channel, same bat time, for those of you who are old enough to appreciate it. For next week's webinar, it's Social Determinants of Health, Revenue Cycle Management's Role as an Agent of Change. And be on the lookout for the Wednesday webinar emails to register. You can also register via the events calendar on the Georgia HFMA website, and we'll be publishing the slate of webinars for this summer very soon. Again, for the presentation today from Chris and Andrea, we'll have that available, as well as the recording. Both of those will be available on the Georgia HFMA website. Mallory, we can also put the link there to the survey if you'd like to do that. Thank you all for participating in the webinar, and thank you, Andrea and Chris, for sharing your expertise. Everybody have a great rest of your afternoon.
Thank you, everybody. This was wonderful.
Yes, thank you.
Thanks again.